Hello, everyone. This is Dr. Sri Banerjee, and today I'll be talking about long-term cardiovascular mortality disparities by race within the United States population. Before I start talking about the topic, let me tell you a little bit about myself. I have been in the area of public health. I'm a trained physician, and currently I conduct research and also teach doctoral level students. Um, and I am happy to be presenting at this year's American Heart Association conference. Um, this topic is extremely important despite a lot of advances within therapeutics and everything. Uh, Cardiovascular disease still remains the leading cause of mortality. If we start exploring some of the racial disparities, then we quickly see that Black Americans experience higher cardiovascular mortality rates than white Americans. So, if we look at a map of the whole United States and look at the geographic distribution of cardiovascular mortality, you'll see that this is more located towards the southern areas of the country. Now, if we're looking at some of the distributions of mortality and taking a look at the age-adjusted mortality rates per 100,000, you'll also see some similar patterns. And so you see that it is important to explore racial differences when it comes to long-term cardiovascular mortality. Even though there's a lot of data out there and a lot of research, it is not clear specifically how cardiovascular mortality is in the long term. So this was unique in that not only did we use a nationally representative data set, National Health and Nutrition Examination Survey, between the years 1999 2010, following up through December 2015. So that was one unique methodological approach. But additionally, we used something called effect modification to not only establish if there was a relationship between diabetes and cardiovascular mortality, but furthermore to try to delineate if there were any sort of effect modification, especially as it pertains to race. So we took a bivariate approach first, and of course we did see that there was higher percentage of mortality even within the population that we were studying after 11 years among non-Hispanic Black population. So looking at the hazard ratio and first looking at the age and sex adjusted hazard ratio for non-Hispanic Black individuals who have diabetes. So if you have diabetes, and so this was expected, then among the Black population, there's a 36% increased mortality from cardiovascular disease than if you did not have diabetes. So this increased mortality rate, the percentage, this is something unique to our study. Furthermore, we found that when we stratified the comparison and looked by gender, so if we looked at non-Hispanic Black males who had diabetes versus non-Hispanic Black females who had diabetes, then we found that within females there was an increased likelihood of mortality for individuals that had diabetes versus those that didn't. So these are very important findings, especially within the context of social disparities and the racial disparities that we found within our study. So it's very important to understand that the disparities that exist and need to be addressed, not only at the healthcare practitioner level, but also at the community level, to not only identify places where there are higher incidence of cardiovascular mortality, but also understand the connection, the strong connection between diabetes, cardiovascular mortality, and how race modifies these effects. Thank you for listening.